Hey everyone, it's Dr. Chris with Texas Chiro Health. Thank you for being here for the 12 minutes to health. You know, this is one of our things in the office that is really our favorite thing to do. It's how we have the biggest impact on our community, on our patients, on our friends and families, and really on anybody who gets to see our talks. So the 12 minutes to health is just our chance to help educate people on what the research actually says about how to be healthy and what that truly takes, right? And really what the research says is it comes down to eating better, putting the right stuff into our bodies, moving more, getting some exercise, and then managing our stress, right? And having that mental attitude of, positivity and a good social network and resilience to the stress that is going to be inevitable throughout life. So, and that's what we're going to focus on here is looking at an article that is dealing with stress, especially in childhood, and how that affects you later in life, which we'll talk about here in just a second. But, it's our commitment to you to bring you the best research we can find. And I talked to you guys about not using the marketing and the case studies and things like that, but actually digging into the real medical literature, the peer-reviewed literature inside the medical journals, so that we can bring you an unbiased approach to living a healthier lifestyle. So I really appreciate you guys. We do these all over our communities. We get out, we'll bring you lunch, and we'll do a talk for you. We do them every Tuesday in our clinic. We have people come in for healthy snacks and refreshments, and we'll do yet another talk every single Tuesday. So, if this is something that you like, get a hold of us. We'd love to come and bring you lunch and just help educate our community a little bit more on what it truly takes, according to the research, to be healthy. So with that being said, let's dive into the research here. The article we're looking at today was done by Felitti et al., and it's called The Relationship to Childhood Abuse and Household Dysfunction to Many of the Leading Causes of Deaths in Adults. So basically what they did, this is not one of the typical randomized control trials that I use, right? And the reason for that is because it's really difficult to study children in general and the environment they're in, have a controlled environment. It'd be a really expensive and long-term study. So what they did in this study is they actually sent out a questionnaire to about 14,000 adults and asked them about their childhood. So when they did this, they got about almost 10,000 of those surveys back, where they were asking about the stresses that you perceive to have as a child, and now the health consequences or benefits that you saw from the stress or related to the perceived stress that you had as a child by filling out this flyer. So really interesting study, especially for me as a parent, right? I know I'm constantly hoping that I'm doing the right thing for my kids. And I know they don't always listen to what I say, but they're always watching what I do, right? And I did the same thing. I mean, I sit like my dad, I act like my mom, I have a sense of humor like my dad, and it's all because that's what I grew up with. That's what I learned, right? So these learned behaviors create habits, and they create lifestyle habits. And that's what this study points out, is how some of these lifestyle habits that have been created from the stress, the chronic stress that these adults are now carrying around from their childhood, how that's leading to chronic disease and early death for these people. So very, very interesting study. So let's dig into some of the facts. First, I want you to know which childhood stressors they looked at, because they looked at a bunch of different ones. And they just asked you, if you have one of these, check yes. If you experience this as a child, right? If you had this perceived stress as a child, then go ahead and check yes. So they looked at if you had psychological stress, physical stress, sexual stress, or sexual abuse, violence against the mother, right? So if there was violence against your mother in your household, they considered that a big stressor as a child, as they should. If you lived with a substance abuser, whether that was drugs or alcohol or whatever it was, or if you lived with someone who was mentally ill or you perceived to be suicidal, then you could check that box. And then lastly, if you ever lived with someone who ever went to prison. And they considered these the main stressors that a child may face, and they wanted to see how is that affecting your health. So when they dig into these things, what they found is that there's a big jump from those people who don't really have any of these or one or two, and when you hit 4. When you hit 4 check boxes in this study, they noticed a huge correlation to your health as an adult. And what they found is when you hit that mark of 4, that you become 4 to 12 times more likely to be an alcoholic as an adult. You're also 4 to 12 times more likely to abuse drugs as an adult. 4 to 12 times more likely to be depressed as an adult, and 4 to 12 times more likely to attempt to commit suicide as an adult. All right, these are obviously big deals when it comes to health. Alcohols, drugs, being depressed, trying to commit suicide, those things are not healthy behaviors. And they notice that there's a real uptick when you have 4 of these stressors versus those people that didn't have 4 in the studies that they looked at. In the surveys that they looked at. They also noticed that as you hit that mark of 4, you become 2 to 4 times more likely to smoke as an adult or rate yourself as having poor health. You're 2 to 4 times more likely to have 50 or more sexual partners, leading to being 2 to 4 times more likely to develop an STD throughout adulthood. And then it showed that you're 1.5 times more likely to be severely obese. Okay, and what they kind of drew the conclusion to, because they get into, it drops down a little bit, you get into the 1 to 1.5 times more likely, but you see that you are suffering from chronic disease when you have these childhood stressors. So they related it to heart disease, cancer, diabetes, stroke, obesity, as you see here, all the other stuff that we've talked about as well. But that was all coming from lifestyle habits. And they found that you are more likely to have poor lifestyle habits if you were in a stressful environment as a child. And that kind of makes sense. I mean, the habits that you're going to create are going to be a product of your lifestyle and your upbringing, right? So, with the kids that were checking these boxes, they noticed real big upticks in eating poorly, in not exercising enough, in having stress and not being able to manage it. And that's because of the chronic stress that they've been under their whole life from these experiences. Right? Now, I'm a big believer, and I don't want to downplay any of these experiences or any of the stressors that these kids are facing, because I can't imagine what that would be like to go through, and I know and I've seen the detrimental effect that can have on your health. But if we can eliminate these things for kids, right? We can't always eliminate them. We're not always in control of an abusive partner, of bad habits of a partner that we didn't know, but whatever it may be. But if we can at least acknowledge these habits as we're growing up, as we're the stresses as we're growing up as a kid, and even as we get to adulthood, we can start to deal with them. I talk a lot about when I talk about thinking at a better level, having a more positive outlook. I talk about having resilience, right? That mental resilience, because stress is totally unavoidable in life. You're going to have stress. How you perceive it and how you deal with those stresses make all the difference in the world, right? Acute stress is you're going to lose people in your life. You're going to have hard times. You're going to have a bad test, a car accident, all the things in life that cause stress. But how do you bounce back from those? How do you view those things? How do you assess those things? And how do you take care of yourself? What kind of mental work are you doing for yourself to decompress, to be resilient, to bounce back and get over those acute stresses? Because the biggest thing they show in this study is what is leading to chronic disease is chronic stress. They're calling these lifestyle factors, not eating correctly, not enough exercise, not dealing with these stresses correctly. They're calling these the root cause of disease and death in this study. Right? Yes, cancer is what you die from on the death certificate, but where'd that come from? What this study shows is that your stress, your chronic stress plays into it. And it plays into it partly because stress is just absolutely terrible for us, especially when it's chronic in our health and it shuts down our immune system and so many other things. But also it causes us to make other poor lifestyle habits. Because when we're depressed, we don't exercise like we should. We don't eat salad. We go for the cheeseburger, right? It's all the things that we choose in our life when we're chronically stressed, when we feel depressed, when we're addicted to something. Those lifestyle choices get worse and worse and worse. And that is what's leading to heart disease, cancer, diabetes, all of the major killers that are happening in our country. So for me, this was a very eye-opening study because it's, you always hear the term that kids are resilient. And I heard someone say this the other day, and I can't remember who it was, but they said, no, kids aren't resilient. Kids are observant, and they're affected by everything that happens around them. Right? And a lot of times they'll laugh through it, they find their coping mechanisms, whatever it is. But when you look at this study and the results from this study and those surveys, you can see that these stressors and during childhood are dramatically poor on their lifestyle choices and for their health as they move forward into adulthood. So it's kind of eye-opening to see this, but like I said, if we can start to make these changes, if we can acknowledge these stresses, if we understand what's happening and we can start to make lifestyle changes, we can have huge impacts on our health. And that's what we get excited about as doctors, right? Is helping people understand how to eat better, how to get more exercise, and how to manage your stresses better and acknowledge your stresses because they're real. But you've got to acknowledge them, and we've got to start to deal with them in a positive way to change our lifestyle and thereby change our health. And that's why we do our special offer that we do. We do our $39 donation from you to our local monthly charity. And that gets you an x-ray or x-rays in our office, an exam, and a consultation. And the consultation's huge, but we also use a proprietary health software where we assess your whole lifestyle, and it gives you a score, right, from 1 to 100, and it helps us realize where are we breaking down in eating, moving, and thinking that's causing our health to not be where it could be and where it should be, honestly. And we find all kinds of things that are leading to pain and dysfunction, but also things like depression, and it's why we're able to have an impact on people with chronic diseases, people who are constantly sick, who are depressed, who are anxious. As chiropractors, when we start working with lifestyle and we start looking at not just, how are your bones moving, but how are you moving overall? What are you eating? What are you putting in your body that you should or shouldn't be? What do we need to get in there? And lastly, how resilient are you? How are you able to deal with the stresses that come in life? So that $39 donation, guys, it's huge for us. We get to give to charity, but also it's huge for us to help get the word out there. And that's the biggest thing for us. We want to be able to educate people, and we want to be able to help. So give us a call. The numbers are there on the screen for you. But I really appreciate you guys, and I can't wait for our next 12 minutes to health. Thanks, guys.